Oklahoma ranks 46th in the nation for the health of its citizens. That includes people of all ages, race, and gender. Chronic health problems stemming from tobacco use and obesity, along with substance abuse, combine as the leading reasons for the poor health of Oklahomans. For the next legislative session, health officials have a singular goal.
Members of the three boards of health, Oklahoma City, Tulsa, and the state, have been told there is one goal for the coming legislative session, and it's a goal they have tried to reach before and fallen short. Get the legislature to increase the tobacco tax by $1.50 a pack. Carter Kimball is Director of State and Local Policy for the State Department of Health.
When I was going back to prepare this, I took great pleasure in changing the title from 2016 Legislative Priorities to 2017 Legislative Priority, singular.
Kimball acknowledges opposition to the tax hike in the past has been largely based on politics.
I heard from a lot of my Republican colleagues that, they're never going to be for it because it's a tax. So that was the end of the conversation, effectively.
But Kimball adds there are lawmakers on both sides of the political aisle that actually support a tobacco tax increase, and hearing from someone now that supports that position will help those lawmakers follow through next year.
The pressure on legislators right now, they're incredibly sensitive to what people in their districts are saying because they have to make sure that that person goes and votes in November.
Past tobacco tax hikes dedicated funds to either teacher pay raises or increasing health care with the help of Medicaid money. This time, where that money goes will be up to lawmakers. And a diverse coalition that formed to support the tobacco tax is still in place and very active.
Many of these groups have actually adopted policies around political contributions based on the cigarette tax vote.
And the need for new money for state government is increasing as the budget hole for next year is getting bigger with every passing day.
The Department of Human Services and the Department of Mental Health and Substance Abuse, who are both going to be in a position to ask for supplemental appropriations. So before we even get to a budget conversation about next fiscal year, the legislature is going to be presented with two major providers and access to care issues.
The Tri-Boards of Health approved the 2018 fiscal year budget request from the State Health Department, which seeks more than $12 million more in funding than the current fiscal year. Since 2009, the State Health Department's budget has been cut by nearly 28%. Commissioner of Health Terry Klein.
And what it really boils down to is no money, no mission. It is very difficult to implement programs and to see that continued push without having an adequate budget.
The State Health Department has already had to shut down 5 health centers and make cuts to other major programs.
We have almost completely eliminated our dental health services in the state. Who would think that in this day and age we'd be looking at a mumps outbreak, which is taking place right now in the state of Oklahoma. Today, we have some communities that have huge increases in cases of gonorrhea, syphilis.
Medication costs for the Agency for Treatment of Infectious Diseases have increased by 470%. Other cuts included funding for federally qualified health centers. Uncompensated care funding was cut, and cuts to Oklahoma child abuse prevention services.
And we simply are not able to have the same level of services provided to prevent child abuse, and I think that is tragic.
The health boards also voted to endorse an increase in fees for mandated state inspections of food service and workers, hotel and motel inspections, and swimming pool inspections. And there is another major expense on the horizon. FMAP stands for Federal Medical Assistance Percentages, a formula that determines the matching funds every year that states have to put up for medical and social service programs. That includes Oklahoma's Medicaid program.
You will see a big number for the Oklahoma Health Care Authority, those agencies that rely heavily on state funding. And if they don't get that money, you will be looking at significant provider rate reductions.
Last legislative session, the tobacco tax proposal was tied to increased funding for the Health Care Authority to avoid massive cuts in provider rates that threatened to shut down nursing homes and basically close access to health care for anyone on Medicaid, something lawmakers will apparently have to face again this coming session.